One of the more common conditions that we see, especially in women, is hip pain. And for some, this can be a nagging type of pain that just comes and goes. And for others, this can start to get really debilitating where it affects your ability to sit, stand, walk, exercise, or even sleep. And for the hip, it's really important to figure out where it's coming from. So we know from research that 70% of hip pain is actually coming from our spine. And then in the hip itself, we can see things like tendinitis, tendinopathy, bursitis, arthritis, piriformis syndrome, femoral acetabular impingement, among some other things. So for us, we take a really comprehensive approach in figuring out where your hip pain is coming from. And we look at how your spine and how your joints are moving, where you have muscle tightness or muscle weaknesses, your movement patterns, and then a good overall history of what's causing your hip pain and when you feel it. And the good news is that most hip pain responds really well to conservative care, and it's not something that typically requires surgery. And in our office, a few things we can do for hip pain is on the chiropractic side, the chiropractic adjustments are good for getting your spine moving and in your hip joint moving as well. And then we can combine things like soft tissue release and dry needling to help any tight muscles release. And then a really important thing for hip pain is starting to strengthen and stabilize the muscles around the hip. So for us, we typically start with some stabilization exercises to get everything firing. And then from there, we can use our tonal home gym to start loading you up and actually building strength around the hip. And a lot of times that's where we get those longer lasting solutions. So if you've been dealing with hip pain for a while, reach out to us. It's something that we love treating, and we'll be able to put a plan together to help you out.